That's awesome. I got a lot of recommendations to check out various Cartoon Network TV shows. So instead of reviewing just one, I thought I'd review a bunch of your requested favorites. That's why today we're throwing it back and reviewing some of the crazy medical and doctor type situations from classic Cartoon Network shows such as Courage the Cowardly Dog, Dexter's Laboratory, and more. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner and I'm an ER doctor. If you enjoy what you see here on this channel, smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
Hey, what's this?
Yep. That's awesome. I love that he messed with the blood pressure cuff, which everybody calls it a BP cuff, but it's actually called a sphygmomanometer. Nice.
You must be the foxy nurse.
I'm the doctor, fathead.
Female colleagues that are doctors, they get it all the time. Hey, you must be a nurse, you must be the tech. They actually literally have to wear their white lab coat everywhere they go.
A guttural obfuscation brought on by gastrointestinal stress?
No, I mean the hiccups. Where'd you get your degree?
Hiccups is more related to muscular spasming of your diaphragm. Your diaphragm is then innervated by your phrenic nerve, which can be getting missed signals.
Let's take a look at your x-rays.
The gerbil controls the left side of my body. And the monkey handles my people skills.
Right.
Getting an x-ray of your head doesn't actually show your brain tissue. An x-ray just shows your bones, right? So that's really literal.
Frankly, Johnny, hiccups usually go away on their own, but if it's serious, come back this afternoon for a more thorough examination.
Oh, it's a serious case, all right. Very serious. So I'll see you later for our date, appointment.
I mean, in my own personal career, my most common person that ends up hitting on me is the 90 and above age range.
Whoa, son, where's the fire?
Oh, gross, man. You know how many times people coughed or breathed in my face? Probably why I'm so immune to so many things, because people have just shared all their germs with me.
Computer, complete biological and molecular spectrum examination of entire laboratory.
Searching. Entire laboratory has germ infestation.
Nice.
Quickly, computer, engage antibacterial environmental bubble.
System engaged.
I love this guy. It's like that old school show or movie with John Travolta, The Boy in the Bubble.
Warning. Warning. Incoming germ manifestation approaching fast.
Oh no! Really good depiction of the germs just flying everywhere.
Computer fire fungus fighters.
Activated.
Nice.
Computer fire second wave.
Oh no! This kid's cool. He's got a whole lab and disinfection, bubble protective layer. Even in the hospital, we're pretty keen on still wiping down all different surfaces.
Oh, this looks...
What is this? Mr. X-Ray.
I know. We'll need the paper gown with no back.
You know how many times I've had a patient put it on backwards? I feel bad. And I do have to tell them to spin it around.
Oh my, your son is in grave danger.
You mean he's not in cow?
These are a cow's 4 stomachs. Your son could be digested by a bunch of enzymes.
There's a misnomer that cows actually only have 1 stomach, but they have 4 sections of the stomach related to different processes that have to occur.
He's not out of the woods yet, but using the state-of-the-art miniature medical camera.
What we use commonly, it's called the capsule endoscopy, where you can actually swallow this pretty small capsule that is actually a camera. Can't get 360-degree view, but it's actually getting a pretty darn good view.
Your son is headed for the 4th stomach with enzymes of questionable morals.
Oh my God.
Go in.
He's going in. Typically, you need to be sedated before you're doing any of these kind of procedures so things can be relaxed.
Chicken! Don't go in! Those guys! Hey, girls. Oh, come with me if you want to live. Quick! Grab my hand!
Get him! He's
We
getting
ain't
him!
gonna make it, Dr. Bottoms.
Chicken, I can't make it! I've cracked my gluteus maximus.
He cracked his gluteus maximus. So the gluteus maximus is the big muscle of your butt. So there's multiple muscles of the butt, but you can't really crack it. You can pull them, you can rupture it, but you can't really crack them. Oh, that's actually really cool. I actually thought it was really interesting that the esophagus actually in the cow was made to almost appear like a normal esophagus with the different folds in it, which is pretty impressive. And then obviously you can see like the tongue in the mouth as the chicken is climbing up.
Someone's coming!
Hello, Mr. Postman.
It looks a little sick and itchy.
Look at his face! Can I touch it?
Oh no, don't touch it. Is it like chicken pox or
He's
something?
got chicken pox.
Ah, there you go. Chicken pox is caused by a virus. Many, many years ago, people would get it, and then if one kid got it, then they would do chicken pox parties. That way all the kids would get it and run its course. It causes these pock marks that are at different stages. There's a vaccine now. A lot of people don't actually get the chicken pox.
Behind you!
He's like a little zombie pock man.
Back, chicken boy! Back, back! Hey, look!
Oh dear, a quarantine.
I've seen this before. Where? There.
Oh no. Why is
It
it?
must be an epidemic.
Hearing these words, quarantine and epidemic now, again, viruses typically do not have any treatment. That it's more vaccines to prevent the body from getting it, to give yourself armor to defend against the virus if your body sees it. Medications for viruses typically potentially keep it at bay or try to reduce the course of it.
Oh no, this is not good. You need a disc transplant. Yes, a disc transplant.
First off, the x-rays is way off. The discs are the cushions between the vertebrae that sometimes people can like herniate and can push on the spinal cord. Nowadays, they can do transplants. It's pretty impressive, and this way you don't have to have like fusions of the vertebrae. This way you still have normal movement at those joints.
Sounds expensive.
Very serious. It's hard to find bone that's just the right size and shape.
Yeah, this guy's talking about the bones, but he actually has this like big disc thing on his forehead. They actually use another lens to kind of bounce off the light. It's actually called, as simple as that, it's called a head mirror.
But you have to, otherwise there are terrible, terrible complications. That'll do. This is a very delicate procedure. Very delicate. Only the most advanced methods can be employed. It requires great care, keen awareness, and a practiced, steady hand.
Spinal surgery is pretty intense, very delicate. You need orthopedic surgeons that are trained, you need neurosurgeons that are trained to be able to do these type of procedures. What? Nice. What is this show? I love that he's in the operating room talking to the crowd, not wearing any masks, gloves, anything like that, but yet the people in the other room are wearing masks. And then he's just using this barbaric treatment with a massive hammer. Obviously, we don't do that or use that. Spinal surgery is pretty intense, very delicate. You need orthopedic surgeons that are trained, you need neurosurgeons that are trained to be able to do these type of procedures. It's pretty funny. Obviously, it's so far-fetched. Medically entertaining. Let me know what you think in the comments, and if there's any cartoons from the Cartoon Network that you want me to check out or any specific scenes. Do you have a favorite show that features medical situations that you want me to react to? Let me know which show or episodes in the comments below. And if you want to see me react to video games, check me out on Experts React series on Gameology, right over here. And as always, make sure you subscribe if you want to see more fun videos like this one. Thank you so much for watching, and stay healthy, my friends.